All right, good morning. So my talk is called It's All About the Approach. And so what I'd like us to get started with is take a look at this picture, and I want you to tell me what it is you see. When I look at it, what I see is I see two things. I see resourcefulness and I see ingenuity. Now I gotta tell you this happened this morning, right? I got up really early this morning and I went on a run, and I would have never ever have thought I would have come across this, right? You're like, what is that? What is that? It's the sole of a shoe. So what I want you to do is take a look at this picture and look at the hinges, right? So this shoe has a particular life expectancy. Someone in the village wore those pair of shoes, wore them out, and then someone else in the village decided that I can use those for hinges. And I thought, like, how brilliant. This is a small village in Ghana that I was visiting last year. And that's why I took the picture, because I'm like, oh my God, they took something that had value, the value went away, and then someone repurposed it. So what I'm going to talk to you today about is actually asset mapping. How do we take something or a quality and add value to it? So you all received a mirror. You have a 2-inch mirror, you have a golf pencil. What you're going to do is you're going to look in that mirror right now, and you're going to answer two questions. The first question is, tell me what it is you love to do. So write that on the back right now. The second thing I want you to write is, what are you good at? So the two things that I love to do is I love to problem solve, and I'm really good at teaching. And so this is me last year in Ghana, and the thing that I want to problem solve is actually this problem right here. So I'm hoping some of you weren't expecting to see this morning, but it's a cervix on your left. And if you ever wanted to know what a cervix feels like, just take your finger, any finger. You can take your right digit or your index finger or your left index finger, hold it up and touch the end of your nose. I'm not going to ask you to touch your cervix, okay, because men don't have one, all right? So that's actually what a cervix feels like, and when you rub your nose like that, that's actually what a healthy cervix feels like. But on the right here, what you have is the human papillomavirus. And the human papillomavirus causes cervical cancer. Cervical cancer kills 266,000 women every single year. And the burden of disease lies in low resource areas. And it's interesting, I've listened to the talks this morning, and it seems everyone is talking about resources. How many resources you actually have to unlayer those images, how many resources Bill Gates has. Last year, he endowed $38 million to his foundation. And I go to a place like Ghana, and I go to this small village that has 125 households, that has electricity, but mind you, they don't have electricity all the time. And I'm looking at, there's not enough resources. And so what asset mapping does is it takes what we have, and that's really the beauty of this particular model, is what it is we have. Because how many of us need something? I can tell you what I need. I need to be 25 years younger, right? That would really help me out a lot. But what asset mapping does, it'll say what it is that you have, and how do we leverage it? How do we identify these assets? How do we leverage them so that we actually are better off in the long run and in the context of solving problems? So these are the women that are affected by cervical cancer. It's the leading cause of death for women in Ghana. And here's the thing about cervical cancer, it's 100% preventable. And here's the thing that actually is even more beautiful, is we have a vaccine, we have a cure for cervical cancer, and it's called Gardasil. And so it's like, well, why don't I just go over to Ghana, just bring a box of Gardasil immunizations, and just give them to everyone in the community? I mean, that makes perfect sense, right? But here's the thing, is the Gardasil shots cost $360. When you're living on less than $2 a day, and you're trying to get your kids uniforms so they can go to school, when you're trying to provide food so that your kids are well nourished, $360 is a lot of money, and they just don't have it. So the next thing I have to ask is, and here's the huge issue with this, is the life expectancy for a woman in Ghana is 58 years. If she has cervical cancer, she maybe lives to her late 30s or maybe to her early 40s. And here's the implications of cervical cancer on a large scale. Is if a woman dies at the age of 38 or 40 or 42, she leaves behind a lot of children. In Ghana, they work in agriculture, and they produce so much agriculture that it actually contributes to the gross domestic product of the country. So when women start dying at a very young age, it affects the gross domestic product of a country. And so it has these huge economic implications. It has these huge implications on the children. And so when I look at these kinds of problems, I'm like, well, how do I solve them? Now I could write a grant, and actually that's where the title of my presentation came from. It's all about the approach, because we're at the University of Arizona, and they like us to write for NIH grants, right? NIH grants, that's the gold standard. That's what they keep on telling me as a doctor. You need to get an R01, an R01. And that takes a lot of time, but the resources actually get less and less. So when I look at asset mapping in the context of this community, if I can identify what's present in the community and how can I build upon it, then I'm actually a lot better off, and as well as the community members. So I have a few items, because you can say, well, Deanna, well, you're a clinician, I'm a physician assistant, I do gynecology, and when women come and see me, I just do a PAP. I do a PAP, I send it to the lab, I get the results back, and I know is it normal or is it abnormal, and then we decide where to go there. Well, we don't have those kind of resources in Ghana. We don't have enough physicians, we don't have enough gynecologists, we don't have enough microscopes, we don't have enough slides. There's so many things that aren't there that are barriers. But here's the things that we have. We have Q-tips, just an ordinary Q-tip. They might look a little different in Ghana. We have vinegar. And we have ice. So one of the things that we do with the resources we have to address this issue, this huge burden of cervical cancer, is I can take a Q-tip, I can go ahead and dip it into some vinegar, I can apply it to the cervix of a woman for 1 minute, and that simple test will tell me a lot about the status of her cervix. If there are abnormal cells, what will happen is the cervix will turn a little bit of whitish, and then I know that there's some abnormal cells. And then with a simple freezing agent, and I can assure you I do not introduce this into the vagina, all right? Let's just be perfectly clear. But we use ice or cryotherapy to freeze those abnormal cells, and we reduce the risk of that woman's lifetime risk of cervical cancer by 60% by simply using vinegar and ice. And it's really amazing. This is the environment that I actually work in. It's an exam table. We have electricity sometimes, but the resources are really, really limited. So when we look at asset mapping in different communities, I can use this particular model, which I think is just a brilliant model because, again, it goes with what I have versus what I do not have. And I can apply this particular model in any context. I can use it in a rural community in Ghana. I can use it in a district in Ghana, using very, very few resources and not having to ask people to bring more in. Because when we think about how do we solve problems, a lot of times we always want more. I need more of this. I need more money. I need more doctors. I need so and so and so and so. And what we find is that is not sustainable. So the solutions that I have to come up with have to be sustainable so that if we remove the money that Bill Gates doesn't have anymore, perhaps, or money from the World Health Organization goes away, then we have only what is available in the community. Here's a couple other resources in the community. On the left, on your right, we have a member of the community. She's at Fonte. She speaks English, she speaks Twi, and she speaks Fonte. And we use her as a resource because she's able to translate. And on your left, we actually have a woman who's a volunteer with Global Brigades. So in this small community, Global Brigades uses volunteers that travel abroad to come and do volunteer work in this community. We use the local resources, which are community health volunteers that are familiar with the cultural and social context, because that's always important. And then we infuse these other resources that are available so that we can address the issue of cervical cancer. And that's how we begin to solve problems that have a global burden. Okay. So I'm going to transition right now. Because I told you that asset mapping can be used in any community. So I just gave you an example of where it can be used in a small community in Ghana. But I'm actually going to tell you how we can use it in a small community in Tucson at the University of Arizona in my classroom, and I teach personal health and wellness. So that's me, and yes, I do jump on tabletops. And one of the things that I told you about myself is I really love to teach. I love to problem solve, and I love to teach. And so I teach undergraduate students, and one of the things with undergrad students, the thing that actually is the biggest burden to them is unintentional injuries, sexually transmitted infections, and the use of substances to include illicit substances and alcohol. And that's a big problem. Another problem is they text and drive. And have any of you ever text and drive before, or drove? Yeah, come on, raise your hands, be true. Okay, so we did a survey, and we know 70% of U of A students text and drive. That's 21,000 undergraduates that are texting and driving. That's a big problem. Every semester I have 128 students. And so what we decided to do is at the end of the semester we have a big multimedia project. And so what I'm trying to figure out is how do I best leverage the resource? And when I look out into my audience, I have 100, in my class I have 128 students, and those are resources. And I have to figure out how do I leverage their assets, their capabilities, their abilities, and their talents so that we can address an issue like texting and driving. So this is my class, and what I do is I break them into 24 groups, and each group has approximately 5 to 6 students. And then they get team names, so they come up with their own team names, and then they have to address a particular issue. Is it unintentional injuries? Is it alcohol? Is it illicits? Is it reproductive health? And they have to come up with an intervention. And so this particular group came up with an intervention. It says, don't text or you're next. And then what they do is they use their available resources, and their available resources are social media. So they create a Facebook page, they create a SurveyMonkey survey, and they create a YouTube video so that they can go ahead and disseminate the information or their intervention on how to reduce the incidence of, for example, texting and driving. And so what we have found is that by using 128 students, by putting them into 24 groups, by giving them each a problem to solve, in this particular, actually the semester just ended for my class on Thursday, is I had 24 YouTube videos that all got on average 100 hits. That means 2,400 undergrad students received a message, whether it was primary prevention or harm reduction, on sexual health, on illicit use, on substances, or unintentional injuries. So 128 students, 24 groups, got access to 2,400 students, and that's something that I can't do by myself. So going back to asset mapping, how do I use the resources that I have, how do I identify them, and how do I use them so that I can best leverage the limited resources that I have? And so asset mapping is a tool that can be used in a community of rural Ghana. It can be used in your classroom. I want you to look at your professors as a resource and figure out how do you better utilize them. And professors should be looking at the students as how do I better utilize and use that particular asset. So I want you to take a look back at this mirror. And I'm going to ask you what it is you see. And I don't know about you, but what I see is I see nothing up there. Now what I want you to do is take this mirror that you've tucked aside, go ahead and pull it back out, go ahead and look directly into it, and what I'm hoping you see is that you'll see resourcefulness and you will see ingenuity, because that, my friends, is the key to asset mapping. Thank you very much.